Namaskar. Sheila Ventures proudly presents a second interview in our series, Let's Talk About OT. April is OT month, and in US we are celebrating Occupational Therapy Month. My guest today is Sushree Tekumulla. She is an occupational therapist and a certified hand therapist. She graduated from University of Calcutta, India. After practicing in India for a few years, she started her next journey to US in 1995. She is the co-owner and the clinical coordinator of two outpatient clinics in Port Huron, Michigan. Her passion to details leads her to this career to be a certified hand therapist and pelvic floor specialist. In her daily practices, she believes in healing touch through myofascial and craniosacral releases to address the pain and improve the function. Welcome to this show, Sushree.
Oh, thank you, Babita, for inviting me to the show to share my expertise and knowledge for occupational therapy and pelvic floor at this time. And it's my honor and privilege to be a so specialist for you, and hope I can help and share my knowledge, and we can take our profession to the next level.
Thank you. Thank you for accepting my invitation. And it's my honor to have you. I know you've had 3 decades of experience as an occupational therapist and working in India and then coming here and establishing your own practice. So it's been a good conversation. It's going to
Mhm.
be a good
Looking
conversation.
forward to it.
Yeah, me too. So, how has the journey been so far in your terms?
Like as we discussed, we all graduated from University of Calcutta. It's been in 1995. Then it's been a 30 years of OT practice. When we started OT, it was a very difficult. What do you do? So I'm an occupational therapist. So it was hard to explain the people what OT is. So we all know there's a gentleman, George Barton. If we all know, pick up our wallet and Speckman and find out. George Barton was our gentleman who started naming our profession as an occupational therapist. So for a decade, we have to explain, okay, am I a pelvic floor specialist? Am I a hand therapist wearing a coat of PT and naming myself as OT? So we have to come back from that um, down lane and put ourselves as a professional expertise on our ground up OT. So it was a journey working towards coming out of the helping people and making sure they're independent and do their the best. So that's what is the journey. Then again, opening a practice, you have to work through your local primary care physician and convincing them there are OT, which we look at the patient in a different way than just not their physical aspect. We are involved with their emotional, their mental aspect, their independence, their dignity. So this is all coming into action, more specialty care as a hand therapist and a pelvic floor therapist.
Yes, as an OT, I can definitely feel the whole challenge of the
Mhm.
journey. Like initially, we always had to explain ourselves as who we are. Um,
How we are different than PTs.
than PT. And that was always a difficult situation for me because I had to always not exactly downgrade myself, but then explain one profession and then talk about me. But then with this, in this 30 years, I have seen a lot of recognition in every field. As an OT, we know we provide in schools, we provide in women health, and that's what you are doing now. And then certified hand therapy, which used to be both OT and PT, but then it is taking, a lot of OTs are showing interest, and it's a very specialized field. And I would like to know, it involves a lot of anatomy and a lot of splinting. As an OT, I have always been, even though we work in clinics, we get carpal tunnels, but then yours is a little bit more specialized. So what kind of injuries do you see, or what kind of conditions do you see where it makes you a certified hand therapist? So what, basically, for my audience, can you please explain?
Oh, definitely, definitely. We all hand is, we call it one of the most intricate body parts that God has created. We need to have so much details in the hand. Sometimes we can see, okay, I'm having a pain in my fingers. That finger pain could be due to a nerve, due to a ligament, due to a joint. So when we are looking at a hand therapist, we look at the most details, what's causing this hand problem, the looking toward more details. So we see a lot of mutilated hand injury patients. Um, in a regular practice, I see, carpal tunnel, tennis elbows, trigger fingers. Not only those, but we see tendon injuries, nerve injuries, laceration, tendon repairs, tendon transfers. Sometimes we have to rehabilitate those patients who had lost the thumb, and that the surgeon has did a toe to thumb transfer. So you have to retrain those people, and the more, like, make their function back in the hand. So the mutilated hand injuries are fractures and comminuted fractures, the little joint displacements. So we do a lot of splinting, dynamic splinting, static splinting, and those are the one causes us a little bit of more advanced care than a regular therapy clinic could provide, because we have to know all the surgical procedures, the technicality of the sutures, the tension we have to put it as their injury progresses week by week. So it could be static splinting, dynamic splinting modalities. We use all the pain modalities. It's a journey. It's a good way of seeing the patients coming cannot use the hand at all, to a point where they can go back to work and completely use that hand as a normal hand.
Thank you. Thank you for explaining that. And I understand that, like, as as we are into this world of computers, a lot of us, even us, when we do the I'm forgetting the exact word, the constant use of the computers on the the keyboard, and the way we sit, the
Sit, yeah.
postures, and it is becoming a trend of having neck problems, shoulder problems, and then that even the hand problems. So these postural related conditions that leads to a lot of conditions. So can you explain if you get that kind of patients, and how do you get the referral for such patients, and what is the process of your private practice?
It's in my practice, usually the doctors usually write down pain in the neck or pain in the wrist or carpal tunnel. So we have to teach those patients. We do a very thorough evaluation, not only the physical aspect of those patients. We talk about, okay, what do you do as your profession, and how you sleep. What's the setup of your television in your room. We could be stretching them left side of the neck or the right side of the neck, but the patient lays down in the bed and look at one side of the TV for hours in the night. And the morning he come back, he said, I have neck pain. So not only we look at their physical condition, we look at their habit, how they sleep, how they sit down, how they work, and we kind of ask them their work situation. Do you work in standing, sitting, how many hours you sit, what is your height of your computer screen, or you do keyboarding. Do you think there is an ergonomical chart? I give it to the patient. Okay, this is how you'll be sitting, this is how you'll be, this should be your height of your chair, height of your table, your computer laptop stand, your mouse, your keyboard, and sometimes some little bit of modification, if they have carpal tunnel and all. We give them a padded wrist rest, so that they can type up easily. So it's then we, of course, I teach them a lot of on food, keep them hydrated, keep them the functional stretches they can do throughout the day, to help their body function and maintain the right ergonomical posture. So it's a whole nine yard of stuff when you work on those kind of patient. We cannot just take them as a neck pain or a pain in the wrist, and I only work on the wrist. So I look at the patient as a whole. What's causing the problem? What's the root of the problem? Can we go down? And if I can give them the stretches and treatment in my clinic, but when they go back home and they go back to the same posture, they're going to come back to me in 3 months with the same pain. So looking the patient as a whole makes a difference with our expertise, to help them so they can learn the new techniques, do the right posture, and so they can maintain or correct their problems for the longer term.
Thank you. And just to reinstate and just reinforce what you said. So we are educators. Occupational therapists are always educating people, always talking a lot about the prevention. We take a holistic approach, as you said, the food, hydration, posture,
Definitely.
ergonomics. I mean, ergonomics, like is a simple thing. A lot of people lay on the phone, and in this day and age, we look at Insta reels, and it's kind of addictive. But then you lay in a certain way
In one direction
causes,
versus other. Yep.
that causes the problems, and especially the carpal tunnel, which is a very common problem that you treat. So even the functional aspect, as you said, how does that relate to their work, to their ability to drive and everything else? So
Everything.
basically, when we describe ourselves as an OT, we look at the person as a whole, and that's so nicely said by you. I mean, it's not just the mutilated injuries where you're doing the dynamic and static splitting. You go a step further to
Mhm.
find the cause and fix the cause, and then make sure they don't come back to you in another 3 months. So that's, it must be very rewarding, I believe.
It is.
I see that sense of
Yeah, satisfaction.
satisfaction. So let's talk a little bit about pelvic floor specialist. That's basically another thing from being a certified hand therapist and then also venturing into pelvic floor. So, what is a common pelvic floor condition that you would treat, or um, why? I mean, how you got into that specialist? Because CHT is a huge thing, and then you went into what interested you. Why did you choose that as a practice now?
Well, if you know, I have twins myself. It's my own personal experience, being a mom of a twins, having a twins pregnancy. I myself had my own pelvic floor issues. So I have been always keen, okay, what is there I could treat myself? And that was my stepping stone of looking into more details to pelvic floor. I said, can I do my pelvic floor treatment as within my area of expertise? So I literally venture out, did a lot of background studies and researches, talked to a couple of my friends who are urologists in the town. So they are very supportive, and they recommended, um, you guys might have to just venture out and bring pelvic floor to our area. And we live in an area which is outskirts of a big cities like Detroit. So the closest pelvic floor places will be a hour and a half drive from where we live. So a person going to pelvic floor therapy will spend 5 hours in a day to get an hour of treatment. So that was something. Of course, my husband was extremely supportive, and he's also a physical therapist. So we decided, okay, why don't we venture out and started a new practice where we both can get certified on pelvic floor therapy. So that was our stepping stone, and we changed. We venture out, open another clinic, which is on 2016, where we started our pelvic floor practice. So I went and got certified myself to be more specialist on pelvic floor, and he went and got certification for his male pelvic floor. There are issues we could address. So that's how we end up having started our own pelvic floor practice, and there was a lot of challenges in the beginning as a OT. Um, to convince the physician, the surgeons. But being in a smaller area, everybody was extremely supportive. They listened to us, and we are very glad we brought pelvic floor to our Port Huron. And we get a referral not only from OBGYN or urologist. You'll be surprised to know I reach out to the sports coach, the gymnastic coach, the surgeons, social workers, psychologists, uh, um, uh, primary care physician, pediatricians. So pelvic floor is such a vast knowledge. So it's not only we will like to treat the incontinence, sexual problems of patients, or pelvic pain. There are little kids who could be trained in pelvic floor. There are triathlon. There are cross country runners. They have so I reach out to the school nurses, psychologists, social worker. There are child abuse. So having getting that help from every organization, the people I approached, I had a great success. It was initially a struggle, but I'm glad I was out helping. I had confidence in our skills, and we went ahead and convinced, and we are able to give a wonderful practice to our offer the services and to our area.
Thank you. So this is very interesting. So we're talking about pelvic floor dysfunction, where any age, from
Yes.
a school going age to a age of 80, so say around 7 8 years to almost 80, where you could have problems with control, not able to control your urination, having pain in your pelvis, um, painful intercourse, which a lot of women have after pregnancy, post pregnancy issues, like you said, when you have twins, or even through regular pregnancy, when you have multiple pregnancies.
Mhm.
And then one of the common things I have heard is not being able to do jump rope. When you start doing exercises as a woman, when you do jump rope or you run, you feel like you have to go to the bathroom, or even going to the bathroom before or after, like a frequent urinate,
Urination.
like the urge to urinate. um, and then the general thing about constipation, which most, pretty much across the board, people suffer nowadays because of the lack of having proper food, like the diet does not have fiber. So it is, even for constipation, as you said. I would just put in a little bit about Kegel, that you mentioned to me before, how people are doing
Mhm.
incorrectly. So let's talk about that, how constipation, Kegel, how that can contradict, about if with little knowledge. So they should always go to a pelvic floor specialist who understands and gives you an overview of what's going on in them.
Um, yes. The thing is, we as a clinician, we have to evaluate every patient as an individual patient. So there's pelvic floor problems could be um, especially the incontinence issues. It could be either due to your weak pelvic floor muscles, or it could be due to your tight pelvic floor muscles. So when you're looking at the incontinence, there could be a stress incontinence issues going on, or it could be due to the urge incontinence. So as Babita, you talk, as a woman, it's not only as woman, it could happen to any age group. We have highly strong, structured CrossFit athletes because I myself go to CrossFit and I know how much heavy workout we do. So, as a CrossFit athlete, they do jump rope, then here they have no control on their pelvic floor. So it could be also due to a lot of tight pelvic muscles because the muscles never get a chance to relax. So when a patient comes to me, I take a very thorough history of what's causing your pelvic floor problem. And it could be also due to be weak pelvic floor muscles. They could really have a lot of childbirth, or they have some pelvic surgeries done. They have long history of endometriosis, or they might have some pelvic floor dyssynergia. That means the muscles are not doing the job they were supposed to. So after taking a good history and what's their problem, and I program their treatment plan based on their needs. Are they needs to be strengthening the pelvic floor or work on an up training schedule, or they're going to do be a down training schedule? I need to stretch and relax those pelvic floor muscles so I can control their incontinence at this point. Again, going back to the constipation, our pelvic floor muscles are very strong. A lot of the time, patient could be having constipation because their muscles are too weak, their perirectal muscles, and because our rectum is sitting on the platform of the pelvic floor. So we need, when there is a urge, our pelvic floor gets a sense of information from the nerves, and it gives the muscles to contract. So I teach my patients, you got to think about as icing a cake. So your fingers are the pelvic floor muscles, so you are holding a cone of icing. So think about you have to go for a bowel movement, your your pelvic floor muscle has to be strong enough to assist the rectum to have a clear bowel movement. So if you have two weak pelvic floor muscles, in a long term, your constipation issues are not going to resolve. Or if you have too tight pelvic muscles, these muscles are not flexible enough to give you the strength to do the kind. So having a good history of the patient, you can really help those patients um, doing the treatment for incontinence or constipation. Of course, I tell them the diet, which you have to do a fiber rich diet. Try to get to the end of the last meal of the day, has to be a fiber in some kind of green vegetables or fibers. So, again, it's very, very patient centered. So, and again, exercises and pelvic floor treatment has to be also very patient centered. That's why patient look at in the different online medias, and they learn the exercises, they do it. They said, we've been doing Kegel for years, but it doesn't work. Yes, they could have a very tight pelvic and they're doing Kegel on top of it. So this is not helping their pelvic floor health to what they want to see. So that could be the reason they're not getting, or they're getting very weak, and they're using a lot of substitution muscles to strengthen those area, and maybe the pelvic floor not getting enough input of those exercises. So when they come to me, I teach them how you are going to differentiate your ab muscles, your glute muscles, or your groin muscles, your thigh muscles, and use your pelvic floor muscles as 80 to 90%. So isolation of pelvic floor contraction is the main key. And that is what patient has to learn from the very beginning. So we plant the seed on the very first day they come in. I teach them, you got to learn how to know to do the right contractions so you can do the best possible way to train your pelvic floor.
Thank you. That's a quite a like a very detailed, very specific information that you gave, that you probably give to your patients, and it's helpful for our for everybody, especially the OTs who are watching this. they can understand that they can make a difference by choosing pelvic floor as a specialty. And I would just add a little bit. I know the squatty potty is something like a little table, I mean, little stool that you can use to raise the knees up,
Mhm.
so that that puts pressure on your area, on your pelvic area. And then we also talk a little bit about hip mobility. Having hip mobility, as you said, the pelvis works as a whole, and it's not just
Just the pelvic floor muscles.
yeah, just the pelvic floor muscles. And of course, as you said, as an OT, we look at the food, the hydration, which is
Exactly.
very, very important for the intestine to move, for the mobility of the intestine. And what makes me really appreciate your aspect of being, especially I'm an OT, so I'm going to be a little biased. We bring in a lot of functional aspect of life,
Exactly.
and that is what makes us a little different from others. And also, I'm not going to specialize any other therapy practices, but as an OT, we have always been taught the functional aspect. So can we talk a little bit about the functional aspect? How does that come into your framework of practice?
So think about the function as a OT. ADL. ADL is that's what we've been taught from the day one. We got to make sure the patients are independent in their ADL. So look at that pelvic floor OT as a pelvic floor specialist. I look at it, okay, when I'm looking at my ADL, I'm looking at if the patient not only can get dressed or get bathed, this patient, the urination, the bladder function, the bowel function, the sexual function, those are the part of just not only we call like not like peeing, pooping, and having sex. Is these are the fundamental function of if you're looking at the ADL when you do your film or you do your functional scoring of our patients, you know. So in a long run, when somebody is having this lingering chronic problem and these areas of their bladder function, their bowel function, their sexual function, not only it makes their body weak, it makes their world very small. So in the long run, these patients not only they are functionally deprived because they cannot go for a long run or they cannot clear their bowel or they are always in an urgency. Okay, do I have enough time to go to grocery and come back and I don't get an incontinent episode? Or interpersonal relationship because of pelvic pain, you know, that also makes a lot of difference, psychological trauma to our patients. So not only they are physically deprived of those functions, their world, like I said, their world became very constricted, very small. So so they get depressed. There's a loss of dignity because of the incontinent issues. They're anxious. Their interpersonal relationship gets affected. So it takes them to a challenge position. So as a OT, so we plant their seeds of confidence on the day they walk into the office, and they believe you. So they open up the most private issues they are going. They are more emotional issues. So not only you treat them as a patient, you are their mentor. They believe in you, they listen to you because they are speaking something they can't discuss with anybody else because nobody understands. They look like normal from outside. So I think as a pelvic floor therapist is very, very rewarding, making them functionally, not only functionally and physically fit, but them to taking to the road of emotional recovery. So hopefully, I think I gave you a answer what you are looking at, Babita, at this time.
Yes, yes. You gave a lot more information than I knew. I know you said that psychologically you're becoming a mentor, because as a profession you understand that they go through the lack of confidence. They have a small world, which that's something I
Yes, very.
they constrict themselves. So mental health, of course, you are promoting their mental health,
Mhm.
the anxiety, the dignity, a
Yes.
woman's dignity, which is related a lot to how she functions down there in every aspect, whether it's sexual, whether
Mhm.
it's physical, in even I would go a little bit step further, like when there is lot of incontinence, there can be infections, there can be
Mhm.
body odor, which we try, as
That's why they don't go out much.
they don't go out. So,
They cut down their social contacts with other people.
and what I liked the best that you said, you plant the seed of confidence in the first visit.
Yes.
And that is how you lead them to the road of recovery. And I
Mhm.
salute for that, because that is something everybody should know. What, as pelvic floor specialist, we do, we treat them as a whole.
Yes.
So thank you for giving that. That's very holistic, as you said. It's a holistic way of treating the patient, and you kind of lined it out and described the whole thing
Mhm.
very meticulously. So, and I think that's the experience that speaks flawlessly. So let's talk a little bit about breathing technique, and how is that related, or how does that promote healing in pelvic pain?
Okay. I'll give you a very example of breathing techniques. A lot of the time, as a normal breathing, we breathe through the nose and we breathe out through the nose. So a lot of the time when you think about you practice a couple of times breathing in through the nose and out, we don't get enough time to get that pure oxygen time for our whole process of exchange happens. So when we have a pelvic floor weakness, we tends to teach our patient learn the diaphragmatic breathing, because that's something you can really help yourself, um, strengthening your breathing techniques and to relax those pelvic muscles. So the breathing techniques are very, very important. Then I teach them the umbrella breathing. Try to breathe through it and try to hold the breath, then slowly let go the breath as if you are closing and opening the umbrella. And when you give them an example of umbrella breathing, their eyes suddenly opens up. Oh yes, I said, just close your eyes, think about you are closing the umbrella and opening the umbrella. So the umbrella breathing, and I incorporate the umbrella breathing along with my pelvic stretches. I said, think about it's a accordion, or it's a harmonium, how it comes, closes and opens. I want you to close and open your pelvic floor when you're opening the umbrella. So our brain is very, very smart. So if we teach our brain through activity, patient learns those techniques very easily, and it comes out as a very clear, oh yeah, I know how to do it, why can't I do it before? So teaching them the right breathing technique to relax the pelvic muscle is extremely important. So I take a lot of time to teach my patients the right breathing techniques to do the pelvic floor stretches.
Thank you so much. A couple of things that I have always talked to my patients about, just general postural, because I do ergonomics. So when I teach them, not really related to this, but I think we can relate to this, is how you stand up, like the pelvic tilt. Most of
Mhm.
us women, we have an anterior pelvic tilt, and we have tight hips. We try to squeeze our hips in the back. So when we sit down cross-legged, I tell them to put uh, the weight on the ischium or the
Mhm.
sit bone, so that kind of separates the tightness of the
Like,
hips, and then it also helps
to
those
stretch the pelvic floor.
stretch the pelvis. So just sitting cross-legged on the floor and just not coming forward and holding yourself up is basically what I teach them. That is also, that can be used even in patients who do not have this pelvic floor issue. It is a general
It's
postural.
a very flexibility issue.
Yes,
You can increase the flexibility. The more flexibility you have, the less tightness you have,
you have.
the less restriction, myofascial restriction you have.
And then second thing that you talked about, diaphragm, which with inhalation and exhalation, it goes up and down. So it puts
It
pressure.
teach them the umbrella technique, and that really helps the pelvic floor to relax.
Mhm. So those two things, simple things, sitting cross-legged. And I would just bring back a little bit of information that I think when I just thought of is when in olden days they used in India, they used to sit on the floor and do the we
Do
call
all the grinding,
it
and
grinding. So
they
that
don't have those.
yes. So we usually sit on the chair and tighten our pelvis with the
So
and
there are few other nicer techniques. It's not only for pelvic floor, but it's a great technique. I teach my patient for pelvic. I said just take two tennis ball and put it in a sock
Mhm,
and make it like a dog toy.
mhm,
And I usually tell them you go and put the tennis ball and just sit between your ischium bone and just tilt slowly backward and forward. Patient with a lot of pelvic pain, I tell do for 10 seconds. Start with 8 to 10 seconds. Just sit on the pelvic floor. Maybe you'll feel a little uncomfortable. If you feel uncomfortable, use your arm, legs, and kind of raise up a little bit. Get those trigger point released on the pelvic floor. So that's having a very handy techniques to do the pelvic plane. Somebody has a deep pain, cannot reach to that pelvic, and
mhm.
they don't have access to a pelvic floor therapist. When patient come, I do internal pelvic massage. I do the external pelvic release, myofascial release of the pelvic floor or pelvic diaphragm. So those techniques also comes out very handy. I teach them the very easy is just squat at the max point you can squat. Hold that squat hold and just try to reach up.
Mhm.
Take a deep breath, reach up, open your rib cage, move the diaphragm up, and just sit on the squat position, whatever you can. And that opens up your pelvic floor too.
Very interesting. Very, I think a lot of our audiences are going to take the tips and use it. Like you said, the two tennis ball. I'm going to try to use it on me and just kind of
And it is a very nice technique. And I think anybody had a pelvic plane, you cannot hurt yourself trying this.
doing that. So if like after seeing our show, if somebody wants to get a pelvic floor specialist, what is the process for them?
Well, the good thing is, I don't know if all our new aspiring OTs who are starting as a new grads and think, if you look at AOTA's website, recently AOTA has specifically recognized our pelvic floor as there was a specific word they wrote down. I pulled out from the AOTA website. Um, it says pelvic floor therapy for OTs is recognized by IOTA as a occupationally centered community practice. So if the new OTs who wants to venture out and bring and expand their knowledge on pelvic floor, your hands are not tied like us, which when we started 15 years ago to do the groundwork, the research, you can go to the IOTA websites, and there is a lot of help and information available. And it's been recognized by IOTA as a being OTs, how much our scope of practice is open as to expand our horizon to practice and bring the pelvic floor to the limelight.
Okay, thank you. That's a very good piece of information. Especially for the aspiring OTs who can choose this as a profession, and as you said, it's very functionally based treatment, and with AOTA's recognition, which is American OT Association,
Mhm.
that recognizes all the practice that we do here in US. So that will become much easier for them to just follow through and go. So
And another piece of thing is every state has their state licensor, state regulation. Please reach out to your state licensing agency to find what is the scope of practice. It could be one in one state may be different in the other state. So that's something just to be for the safety of the practice guideline. Reach out to your state licensing agency or licensing board and they will have information. They will lead you to the right sites to look at those information too.
Okay, thank you. And I would also link your information. So in case somebody wants to get hold of you or try to get some advices from you, they can contact you. And if they know of any patients in your area, or you could even recommend them where to go to. Uh,
We do have, if anybody is interested that they're in a different practice or different location, they the I learned all my pelvic floor from Herman Wallace Institute, which is a pioneer of pelvic floor therapy. They have repeated courses and more details information, and they can go to find a pelvic floor therapist, and they will find out who are your areas of certified pelvic floor therapist. Um, and of course, you can Google it online and find a pelvic floor therapist close to the area. But again, learning them, teaching them, and getting them connected emotionally and being there mentally and giving them the psychological support along with the physical help is extremely rewarding as a pelvic floor therapist.
Thank you, Sushree. It has been a very educative. I feel very proud to be an OT and to be sitting with an OT who's done so much specialization. I have seen some patients as an OT with the knowledge, a little bit of knowledge, but the specialization takes to another level because you have to put in a lot of studying. And I know you have done a lot, both as a certified hand therapist and as a pelvic floor specialist, which is your ongoing um, thing that you're doing. And very proud of knowing you. And also, I wish you all the best in your own practice. And I wish that all the students who are just coming out, and since this is the OT month, I'm hoping that an OT who sees this sees that there is tremendous potential in any and every field that you can choose and contribute as an OT. And as you know, I am hesitant, but I will say this: not many people know how much we contribute to the well-being and how much we treat and how good we are in terms of the mental health, addressing the mental health through our treatments, through, as you said, putting in the seed of confidence, which is the key to healing, how good we are as healers, especially through the knowledge base
Through
that
the
we have.
techniques and knowledge.
And before I end, I would definitely want you to speak a little bit about myofascial release because you did say craniosacral and myofascial, and those are um, quite intriguing for someone who doesn't know what it is.
Those are the techniques we call rhythm of life. So in our human body, we have our whole rhythm. So in those techniques, especially the craniosacral techniques, definitely again you need years of practice, training, and learning to be mastered on those techniques. It's on your hand. You have to feel those simple rhythm of your body and kind of channel those rhythm to release the tension, the stress, the pain. So the craniosacral rhythm is called the rhythm of life, and you got to feel by your touch and heal those areas through this technique. Of course, myofascial release, we know our body from our skull to our toes. It's a whole layer of fascia around it. Is if you cut a piece of chicken, you see a very thin layer of white seeds on top of the meat. The same way, our body, our structures, everything is related to a whole fascia. Sometimes you have to release those fascia. It could be disrupted at any point, any portion of your body, but the dysfunction can be seen in a different body site. I have treated patient with chronic migraine for years, but the patient has fallen 20 years ago, had an ankle fracture. So the fascia on the lower limb and the calf was so tight. and that was giving a dysfunction at the cranial site. So you got to evaluate the patient again, increase your knowledge of evaluation and learning your body's anatomy and structures. So I went ahead and released the calf and the hamstring and the leg. Those released those fascia structures, took care of this patient's headache. That patient can be having that headache for last rest of their life. So my facial release is just with light touch, finding the fascial restriction, release those restrictions, can release a lot of somatic dysfunction. Again, the same concept of the craniosacral, which is more deeper concept, where we have to feel the rhythm of your body, and through your touch, you release those structures.
Thank you so much. This has really been a very good professional, one-to-one information. Two OTs speaking about all these terminologies, and
That'll be a never ending.
it is never ending, and it's so detailed. It's 30 years of experience that we gained, and it's a lot. But then what the bottom line is, everything we do is centered around taking care of our patient. When a patient comes with a migraine or with a pelvic pain or with a mutilated hand, they come to the clinic. They get the seed of confidence, as you said. Then they get better every day. And then from a mutilated hand to using the hand normally, or from having issues about self to getting out in a couple of weeks and being normal. That is what we do for living. And I thank you. I thank you for choosing occupational therapy. And I think I feel honored to be with you in the same frame where we discuss about what potential we have as an OT to bring to the society. And there is so much help that we can provide. So, do you have a few lines and then we will?
Yes, like I said, I know you from last 30, over 30 years, and I've been always admire you. You also, rather than a OT, you have a families to take care, patient to take care, but you're always there for other to educate the people, bring the best out of them. What is there, reach out them and showing them the path. There are so many other avenues, so many other paths, and people like you are really very appreciated, to bring it to the normal people who doesn't have access, who doesn't know what's going on. There are help available. So that takes a commendable work to, instead of a weekend going out and spending time with your family, you are doing that. So I really, really admire that.
Thank you.
And, and and then most importantly, we're there for our patients, not only to support them physically, but definitely mentally and psychologically, to bring them to the best well-being they could be. And I couldn't have done that without the support of my very supportive husband, who is a PT, always there. If I have a questions about my pelvic floor, hey, I'm doing everything to release this hip, and if I could release this hip, I can take this patient to the next level. So he's always there. Okay, let's. So it's having a group help. Again, my kids are always there supporting, three of them. Anytime I need, hey, I need help in this computer, I know to do this presentation. So without the family support, we cannot do what we are doing today.
Yes.
So I
Yes.
definitely would like to thank you them for their support.
Thank you, Sushree. And it was a pleasure. I learned a lot. I will continue, being in connection with you with my questions. And anytime I have a question about hand,
I'm
I
always
call,
there.
I call you and you give me with all the detailed information. So I think that's how it's a
We grow as a professional.
as a professional, we grow and we get the support of each other. And as we said, our jobs are very patient centric, and we take pride in that. And I wish you a very happy occupational therapy month, and please continue doing the work that you have been, and very detailed oriented. I have known you as a very detailed oriented and always trying to do better, and I thank you for that. And I thank you for the opportunity that we all have gotten being an occupational
Now,
therapist.
my pleasure. Thank you for inviting me to speak.
Thank you.
Thank
Namaskar.
you.
Namaskar.